So this section, we'd like to go over positioning and latching your baby, which are some of the kind of nuts and bolts of getting that baby to the breast. But I'd like to start with a video that actually shows a baby getting on the breast all by itself. And that's just to help you reassure you that you're not in this by yourself, okay?
Studies have been done on newborn babies and their ability to self-attach to their mother's nipple. When placed on their mother's skin to skin and left to their own devices, they can innately find their mother's breast and latch on.
You amaze me.
This process is called self-attachment. Elizabeth is 3 days old. When laid on her mother's chest to see if she would self-attach, the first thing we noticed is the strength of this baby, bringing her head up and seemingly very alert. She moves towards the nipple and nuzzles and licks at it, eventually latching on and beginning to suck. Research has found that babies that self-attach usually have an excellent latch, and moms report less breastfeeding problems, such as sore nipples.
So as you saw on that video, the baby was able with very little help at all to get onto the breast. So there are a lot of instincts that the baby has to help them find the breast, help them open their mouth, latch on, and start sucking. Okay, so we are going to go over some different positions that you're going to hold your baby in for breastfeeding that can be really helpful. So one of the things you'll see babies swaddled up and nice and snug like this, and it's actually can interfere with breastfeeding because the baby cannot get as close to the breast as necessary, but they also, even though these hands get in our way, they actually use them to find the breast. So we're going to unwrap this baby. And I'm going to start with the most classic position that moms will hold their babies in. You're holding your baby here and it's time to eat, okay? So you're going to want to just say from here, put the baby on the breast. Well, that's really easy when the baby's not moving and your breast is at that position, okay? You want to do a little bit of moving, even in that cradle position. Turn the baby toward you, so there's not any air pockets at all. Okay, when you line up a baby to feed, you want baby's nose to be lined up with the nipple. I know that sounds strange. It's really hard to imagine. They're not going to eat in the nose, they're going to eat in the mouth. So moms tend to push that nipple down in their mouths. But to start, you want to actually have that up by their nose. So it has nothing to do with you trying to move your breast to that position. You actually want to put the baby in that position from the start. Okay, so you're going to start out in this cradle position. You've got one hand on one side of the breast, one on the other, and baby is at the nipple right now. Okay, this position is really hard to control your baby's head. So that's why we don't really recommend that so much in the first, at least the first few days while you're learning to breastfeed. So what we do recommend is what we call a cross cradle position. So the baby's in the same position, okay, across you. Tummy up against your tummy, the ear, the shoulder, and the hips, they make a nice straight line. Baby doesn't have to eat like this. You don't sit at a table and eat like this, right? Babies don't either. So you're going to want to have them nice and straight. You also want the baby to be able to tilt the head back, okay? So that the nose will come away from the breast and the chin's going to come in. So with the cross cradle position, you are actually holding with the opposite arm. You're holding the baby with the opposite arm you're feeding on. Now, I don't have my hand up here. I have it down here, okay? So you're supporting, the palm of your hand is supporting the shoulders and the top of the back, and your thumb and your fingers are going to be holding kind of the base of the skull there on the baby. And then use your forearm to support the baby's rump, okay? Now, I don't have any pillows here with me right now, but you want pillows. Pillows are your friend, okay? So start out by you getting comfortable and then put pillows around so that you can support the baby at the level of the breast. So this is the cross cradle hold, okay? And I'll go over just how you're going to hold your hand, but your hand will support the breast on this side that you're feeding on. So you're going to bring the baby into the breast, you're supporting the breast, and that's the cross cradle hold. Now, if you take the same position that you're holding your baby in and slide the baby to the other side, this is what we call a football hold or a clutch hold, okay? Now, you still want to line that baby up with the nose at the nipple. So a lot of times I'll see moms, they have their babies out here and they're trying to bring their babies in. What happens is they bring the head in like this, and nobody can swallow like that. That's very uncomfortable. Baby's going to want to fight you there, okay? So you slide your baby back farther, and that's going to make it much more comfortable. But again, your arm, your forearms kind of holding the rump, your palm of your hands holding the upper back and the shoulder, and you're still kind of supporting that head a little bit, not the top, but down at the base. And then you'll be able to support the breast with the other hand. I'd like to just kind of talk about the side lying position. That is a very comfortable position. It's not always easy initially because you're not able to control the baby's head as well again. But you would be lying in the bed. You turn on your side. Baby is up against you, kind of feet down by your belly, head up by the breast. Your arm will come around them like this, and they will just kind of, you'll be able to support the breast this way, okay? So that's side lying, and again, it's very comfortable. You'll be able to rest in that position. One position I really like to show moms, and especially after delivery, is called laid back or reclined, and that is because you've got your baby skin to skin after delivery, and again, the baby's going to actually start looking for the breast, so they're going to help you in this position. But they're on their tummy's up against you. Again, their body's straight, their legs come down, and they can actually use their legs and their arms and really push and kind of search for the breast. And then they have reflexes in their face that if you touch their cheek, they turn their head and open their mouth. And once the nipple gets in the mouth, they've got a suck reflex at the roof of the mouth, which gets them sucking. So in this position, mom can rest. Still, you've got pillows on each side. You're going to allow the baby to kind of come over, but what's happening when you're lying back is your baby's bringing, the gravity's pulling baby into the breast, which is really going to help with that getting a deep latch, okay? So different ways that you can hold the breast. You're going to hear people say, oh, you can hold it in this letter and that letter and this letter, but it's really, what you want to do is be able to support the breast. You don't want to be holding it like here. Why? Baby cannot get anything but this. If you bring the baby into the breast here, you are getting just that nipple. That hurts a lot. You want baby to have a nice deep latch. Everybody's anatomy is a little different. So the areola, you can't say you got to get the whole areola in. You'll hear that though, okay? It really depends on your anatomy. But what you do want is a good bit of breast milk behind the nipple. So as you're holding the baby, with one hand, you're going to support the breast with the other. So this is a C, so you can hold the breast in a C position. This is a U. You can hold it in a U, but you're doing this wrist kind of sliding around. There's also, I'll see moms do this a lot, okay? Which, if it's far enough back, that's fine. But again, what tends to happen on this is about here. And then the baby's chin, which is supposed to go here, is not able to get on, okay? So when I say a C hold or a U hold, we're just talking about the position of your hand, a C or a U, okay? So what I would like to discuss is an asymmetric latch that is going to be most comfortable for you, and it's going to help the baby transfer the milk well. Asymmetric, meaning you're not coming at it like a bullseye, okay? You're coming at it with more of the breast tissue in the lower part of the mouth. So you're actually going to see areola up above the mouth, okay? So what does this look like? Okay, so you've got baby, you're holding baby up against you. There's no air pockets here. You've got the palm on the shoulders, a palm on the back, and the hands on the shoulder holding that head, right? So you can bring the baby into the breast. You line the baby up with the nose at the nipple, okay? Now, typically what happens if the baby's nice and close and you just got the nipple here, baby's gonna open that mouth nice and wide. That's what you want to wait for. Don't try to get it in when they're like this. You're going to hurt yourself, okay? So wait till they get that nice wide mouth, and then you're going to bring them in chin first. Now, I know looks like this isn't going to work. The nipple's attached, okay? So as the baby comes into the breast, that nipple's going to go in, okay? And then the baby starts sucking, and it's on the breast tissue. It's not here. This is painful, and this can cause problems. But this is where you're going to get that nice massage on the breast. The baby's going to be content there. The baby will stay on the breast, and both of you will be happy, okay? So at the end of a feeding, you're going to want to see that baby is wide mouth, okay, wide open mouth. Baby has a nice strong tug. And what I'd like to do is show you this video about correct latching, which is going to kind of go over what we just talked about, and then we'll go over that again.
We're going to do a folded pillow on your side here. Folded pillow on your other side. We're going to make a little fort around your body to kind of keep baby up to the level of your breast. One of the things we want to do is unwrap baby and wake baby up first before feeding. If she's not interested in feeding, we can do a little skin to skin and just kind of play with her and talk to her, but she's ready. So the first step to a good latch is we're going to roll baby in on the side. Have you take this hand, come around baby. Okay. Thumb underneath the ear, index underneath the other ear. Take this hand, and you're going to shape the breast to match the shape of baby's mouth, almost coming underneath like the shape of a U.
Okay.
Okay. Nipple to nose. Wait for that wide open mouth. When she opens wide, she's telling you, I'm ready. I want you to put your hand down just a little bit more so that you don't block any of her latch. Perfect. When she starts sucking, I want you to take your hand and push in from the shoulders and roll the baby's head back just a little bit so that her nose is free. There we go. Sometimes it takes a few tries. There we go. So if it hurts at all, we want to make sure that you wedge the breast to match the shape of the mouth. Push in deeply from the shoulders. This allows the head to fall back. Okay. The nose falls away from the breast so they can breathe easily. And there's a nice little space right here that allows the baby to move her jaw efficiently. And if she's sleepy, you can use compression combined with stimulation to keep her actively feeding. There we go. The perfect latch.
Okay, so you got to see a nice, really good latch. The baby has that wide open mouth. The lips are flanged out, kind of like a petal, okay, which takes pressure off of the breast. The tongue is over that lower gum, okay? Now, you're not going to see that from your angle, okay? But you will feel it. If you feel biting and pinching, the tongue is probably back farther and not really doing its job. You want to see a nice strong tug where you can see all the way back in front of the ear, those muscles pulling, okay? And you do want to hear swallows, even with colostrum. Every 5 to 15 sucks is probably average for when a baby is at the breast and you've got colostrum. Some moms that have breastfed before, it does come and they swallow more frequently. Others, it might be less, but we want to make sure they get that good latch. Now, once your baby is on the breast, say you have to go to the bathroom. Okay, I have to go to the bathroom, I can't take the baby with me. Well, later, you might be able to do that, but right now, no, you can't. So how are you going to take this baby off? You're not going to pull the baby off. That's going to hurt so bad, okay? So if the baby is on the breast, you're going to want to take your finger, and you can do it from this side at this position. If dad's there or your support person, they can help from this side. But what you're going to want to do is just kind of get right at the corner of the mouth and pull back, just gently pull back. You're going to hear like a release, okay? Once the baby releases, you can take her away. But if you still feel that suction, the baby probably has that tongue cupped around the nipple. Don't pull her away yet. Take and press just gently on that chin, and it'll lower the chin and drop the tongue. Once that's done, you can take your baby off. And that will be much more comfortable for you, and then you can let your support person hold that baby and you go to the bathroom. Once you are done feeding on one side, you're going to want to burp a baby. There is no air in the breast, but the babies take in air when they're crying, and they digest their food, which will produce air. So you always want to try to burp a baby after feeding. So you've got your baby here, baby's done, you're just kind of lying there. So all you have to do is really slide that baby up a little bit more, and then just give some good pats. Now, typically what I'll see is the baby's all crunched up like this, okay? If your baby's torso is not really open, they're not going to have any of that little pressure to help. So if you pull those legs down, you're not going to hurt your baby, okay? Just gently pull those legs down and get their tummy up against you and do some good pats. You'll probably get a good burp, okay? As they get older, you can put them up here more, okay? You've seen that. One good position, which, oh good, my baby is going to bend for me. You can put your baby up like on your thigh, and just what you're going to do, you're going to worry, of course, that the baby's going to get hurt, but the baby's not, okay? It's going to look like I'm choking this baby, but I'm not choking this baby. You're going to take the palm of your hand on the baby's chest and use your thumb and your finger at the base of this jaw here, okay? But now, if you let go, the baby might fall back, okay? So lean the baby forward just a little bit and get a good pat like that, okay? That's going to help to get that air out. That is our section on positioning and latching. So we'd like to go on with breastfeeding challenges for the next section. So join us for that.